Good evening, everybody. This is Dr. Carmen Echoes, your friendly family medicine physician. I help patients and their families break the generational cycle of death and destruction due to chronic disease through public speaking and patient education. And today, I actually want to talk to you guys about the purpose of the annual physical exam. And the reason this came up is a lovely fellow family medicine colleague of mine posted, I guess you could say, where a patient gave her a rating based on their experience with her during their annual physical exam. And unfortunately, they gave my colleague a 2 out of 5 star rating, and the patient explained the reason being is that the physician didn't answer her questions or didn't address her complaints, rather, during the annual physical exam. And that is why she rated this physician a 2 out of 5. There's several layers to this. Of course, it was apparently a Press-Ganey survey. As any physician about the Press-Ganey survey, we're not necessarily really fond of those, but it's a patient satisfaction survey. Some major institutions, hospital institutions, do use the Press-Ganey scores to determine compensation as well. So that also didn't make the physician very happy that that particular reason was why the patient scored her a 2 out of 5. So, but to me, that brought up something that I address frequently during my encounters with patients on a day-to-day basis, and that is exactly what the annual physical covers and what it does not cover. So I guess we'll start off with what the annual physical covers. The annual physical is like taking your car in for routine maintenance, in a sense. You get asked about your last pap smear, colon cancer screening, mammograms, last bone density test, prostate exam, um, basically anything that leads to prevention of development of a disease. Get asked about exercise, smoking, sleep habits. Are you sexually active? Um, that type of thing, really. An entire review of symptoms, as we call it, any stomach pain, nausea, vomiting, joint pain, depression, anxiety screen, that's also a part of the physical exam as well. Those things get asked about, and sometimes, yes, things do come up once we ask those questions. Detailed physical exam is done, and then, of course, we do blood work and patient education about what to expect and how to prevent chronic disease, things that you can do to prevent chronic disease, or things that you can also discuss with your physician or healthcare provider about preventing chronic disease. All right, that is what the annual physical is. The annual physical is not a time to, oh, it's been 3 years since I've seen a doctor. I need a physical, and here is my scroll of medical problems. That's not what should be addressed at an annual physical. And as I mentioned before, sometimes during the review of systems, things come up. Oh yeah, I am having this back pain. Well, how long have you been having the back pain? Well, I've been having it for a couple of years. It's been a while since I've seen a doctor. The back pain ideally would be addressed at a separate visit. So the patient who was disgruntled, I'm not sure if that was explained to her or not. I was in an exam room. I really can't, say what was discussed or what was not discussed with the patient, or how my colleague addressed that aspect of it with the patient. But I just wanted to mention the fact that I get that all the time. A lot of patients come in, they want a physical. Oh, yeah, doc, while you're at it, can you address these problems as well? Usually, a couple things happen. I understand that people take off work, and if I have time to address those issues, I'll address those issues, but I'll also tell the patient, look, this is not part of your preventive visit. Your preventive visit is covered if this patient has insurance. Your preventive visit is covered at 100%. However, if I address your back pain at this visit, you may get a bill from your insurance asking you for a copay or asking you to pay part of the deductible, and that's why. That's just how insurance companies work. Unfortunately, I can't control that piece of it. If it is there are a lot of concerns to address, chances are there's no way I can address those concerns and a physical. I honestly won't try because I'm very detailed and I want to be able to address those problems thoroughly, accurately, and document them. So I'm like, look, this is a lot. Please, can you make a separate office visit so we can address those concerns at a later date? And I'll just document in the chart that, hey, this patient had this concern, that concern, and the third concern, and then I'll address those at another visit. I often tell my patients, if you're that concerned, make an appointment to see me tomorrow. If you're able to see me tomorrow, I will see you tomorrow for your concerns to make sure that they get addressed. And also kind of leaning in a little bit on the time issue as well. So many people in general now talking about this. Is it true that doctors have to have only like 8 minutes per patient for a visit? Well, our time is limited with our patients, unfortunately, and we do the best we can with time restraints. And if you could imagine, everyone who comes in for a physical says, hey, can you address all these concerns at my office visit? Well, that's going to put me, if I'm on time with you, it's going to put me behind in clinic for the next patient. And just think that if I have 5 patients coming in for a physical, that would put me behind a lot if I if I did the physical and addressed concerns of every single patient who had concerns along with their physical. It's just honestly kind of tough. So I did want to put that out there. It's not that physicians don't care about you. It's not that we don't want to listen to you. On the contrary, we want to give you the best care possible. And sometimes, due to insurance restrictions, time constraints, we're just simply not able to do everything in one visit. It may take multiple visits. Oh, and I admit, another little pet peeve of mine is the hand on the door complaint, especially when it's something major. Patient comes in for a physical. I finish the physical. I get ready to leave. Doc, I forgot to tell you, having this chest pain. Seriously? Your chest pain would have taken priority over that physical any day. Y'all, if I'm not your primary care doctor, first of all, please don't do that to me. Don't do that to me. If I'm not your primary care doctor, don't do that to them either. If you're having chest pain or something that warrants a little bit of urgency, even if it's chest pain or shortness of breath is off and on, let that be one of the complaints that you tell your physician as they are walking through that door. Or better yet, tell the medical assistant. There you go. Tell our extension. Tell our medical assistant, so they'll in turn will tell us, and we will be prepared for you and be prepared to give you the best care possible so that we can determine what's going on with that chest pain and that shortness of breath. Because, yeah, we don't like that. We don't like that at all. All right, so I am going to close out here. I'm not going to take up any more of your time. Share, because I've heard this complaint about, well, I'm having a physical, I want all these concerns addressed, or negative comments or negative feedback, I should say, from patients regarding my colleagues. Well, she just asked me about my heart and my lungs and asked me about my mammogram and didn't address my concerns. There's a method to the madness. There's a method to the madness, and I feel like everybody should know. All right. Have a phenomenal Monday evening, and I will holler at you guys later. Good night.